Yeah, so I'm a board certified emergency medicine physician. So, recognizing when you go to an ER, you don't always have a doc that's perhaps trained in emergency medicine. Mm-hmm. There are physicians that do a great job, working in ERs across the country, and you look at about a third of the department of physicians in the country are not EM trained.
I didn't know that. Yeah. I just, when I go to an emergency room, you just kind of think that everyone or any doc that you're going to get is trained in emergency medicine being in that. Yeah,
not necessarily. So, you may have family practitioners that were more or less grandfathered in to do that work. I've worked with general surgeons that have decided, they just want to do emergency medicine, anesthesiologists. We're the only specialty in medicine that allows other specialists to work within our respective field, right? So I can't take my board certification and my training and go do vascular surgery. Right. I can't go and do surgery on somebody's bones like an orthopedic surgeon would.
Right.
Emergency medicine is its own respective specialty, and it's really intense training. And it can be the difference in how you're managed in an ER, and depending on difficult rural departments are typically really hard to find board certified EM docs. Smaller hospitals. So you may have a doc that's been working the last 20 years in the ER and does a fantastic job and understands the role they play in the specialty itself, and they were just never trained in emergency medicine, and they're not board certified in emergency medicine.
Right.
So there's a difference there.
Yeah. So for a lot of us, a lot of people that listen to this podcast are hunters. And then also a lot of guys, maybe it's knife makers or people that just work in a shop or in an environment where a case of an emergency is actually maybe more possible than other occupations. If you work a desk job in an office or something like that. As hunters, we go out in the field, or outdoorsmen, fishermen, off-roaders, we put ourselves in positions that, start to raise the chance that we're going to have an issue. Breaking a leg, a puncture wound, a fall, frostbite, whatever. I mean, go down the line. And it's actually interesting because we actually ran down this rabbit hole just a little bit, because in the past few years I've gotten fortunate to become friends with some guys with medical training, really in the military, and guys that have gone over corpsmen and people like that, Green Berets that are highly trained in emergency medicine on the battlefield,
right?
And I started to really realize, and I never really thought about it, but, especially after I took a couple classes from a guy like Tier.
Yep.
CIMAC, and it became apparent to me how much I was kind of hanging out there, and especially putting like my own kids at risk, right? That's when it started to matter to me. Was he did a training on a tourniquet, on just how to use a tourniquet. I'd never done that before. I think we did it at Winter Strong at Bert Soren's. Yeah. And he showed how to apply a tourniquet, how to check for a pulse and all that stuff, and answered a few of the kind of typical questions that you would get with that. And then he said something that really struck me. He's like, hey, this thing's like $30 or whatever. And now you know how to use it. So if you find yourself in a car accident, which is probably one of the highest chances of risk of emergency type situation that we're all going to have, because we all drive, right? You're likely going to have some form of an accident in a car in your life, whether it's really minor or major, or you're going to witness one. It's probably going to happen. And he said, if you're sitting there in your car and your wife or your kid is bleeding out and they pass away, and all you would have had to have had was a tourniquet to apply to save their life, and you had the knowledge, and you probably even knew you should have one in your car, but you didn't go buy one and put it in your car, and you watch your daughter bleed out, now you got to live with that, right?
Right.
And it was a huge, like, holy shit.
Big revelation there.
Yeah.
Like, wow. And then take it a step further. So people will buy tourniquets, but where do they keep them? Right. So
unreach in the trunk,
unreachable. Well,
right. Unreachable.
Not even in the vehicle. Like, so somebody may buy, a med kit. There's a ton of kits out there. MKC puts out a kit. They buy a kit and they throw it in their hunting pack, which, off season ends up hanging in the garage or,
and that's
in storage.
That's why I brought that med kit up, because that really drove me when I started looking through my hunting pack. I had some Band-Aids and some bullshit in there.
Right.
That you really don't need.
No.
It's comfort stuff, maybe.
Electrical tape.
Yeah, exactly.
That's my Band-Aid out there. It's electrical tape.
Yeah, I was a lineman.
So many utility.
I was a lineman. I had endless electrical tape rules. Yeah. So I put electrical tape in my dad's stocking.
I've been walking around here all week with electrical tape on my finger because I unsheathed my knife.
So that's why we did that. Tier helped guide us on hey, what should we put in that pack to go in our hunting pack that is strictly life-saving? If someone buys this emergency medical kit, they can choose to put, Band-Aids and whatever else in it, electrical tape. But to your point, that med kit also, and I wish I could get this point across to people more, was also probably even more important than your hunting pack, because you hunt a few days a year. I mean, some people might go for a couple weeks, but a lot of guys might get out a day or two. Right. So where's that kit sitting the other 363 days a year? It should be, and should be one in every vehicle. And to your point, I put a carabiner on it where it's hooked onto the seat, the back seat of your vehicle, right? The back seat of your own seat where you can reach it.
Make it accessible where you can reach it.
Because if you're pinned in your seat in a car accident and you can't get out of your belt, or you're pinned in there and your wife is next to you and she's bleeding, can you reach back and grab that tourniquet, that kit, and reach over and try to provide some help or some care? And same thing, I tell that to my kids too. Like, you have to be able to reach it.
Yeah.
So that's a really great point. And side note, personally, when we're actually off this, I do want to look through that kit with you, because I want to talk to you about it. Mm-hmm. It is funny because I talked to you or like a Tier when we were going through that and we're putting that together. Tier's like, well, you should have this and this and this, like, because he's been in situations where he's had to use this stuff, right? And he has experience. And I'm like, well, hold on. I'm trying to make sure my buddy Chris over here is actually going to carry it.
Right.
If I can understand why you want to put all this stuff in it, but I have to make sure this is light enough and small enough to where my buddy who carries electrical tape for his first aid kit now isn't going to go, well, that's too heavy and bulky.
Right.
So, like, we're going to have to make some compromises here on what's needed.
Yeah. Yeah.
And I think, honestly, that's where we're going to get into this conversation, because I think that's where it's important for every individual to maybe seek out some knowledge, like from a guy like you, of like, okay, we bought this kit from MKC. It's good, but Mike says I should also maybe have this, and this.
Yeah. Good. How do we make it better?
Right.
Right. Because in the right hands and with the right level of training, it does mean life and death in the field.
Right.
Right. So, going back to, Tier, I have a tremendous amount of respect for Tier, and Tier and I have spoken, quite a bit about, our backgrounds and our experiences, and they do clash. Right. So they intersect, but recognize, he had a way more difficult job than what I do, being in combat, being in a battlefield, dealing with that as a, true first responder, taking care of his buddies. I'm oftentimes, on the receiving end of that, have experience of going to those, fatalities, those scene calls, motor vehicle accidents, those types of things. He's really in it. Yeah. So his perception of what is absolutely needed within a kit, is going to focus a lot on his background, his experience, which is appropriate.
And his whole entire career was spent with a much higher probability that he was going to need all that stuff.
Oh, absolutely.
I mean, we're talking about a kit for a hunting pack, which, likely won't need any of this stuff, or hopefully won't need any of this stuff.
Right.
And likely, if it is needed, it will be relatively minor. It's a cut from a knife while you're gutting out your elk versus multiple gunshot wounds or something like that, or an explosion.
Right. Yeah, you're not going to be out, archery, elk hunting and come in contact with an IED or anything like that.
Right. Yeah, lose a limb.
Right. Yeah. You're not going to have that Tears unfortunately experienced, quite a bit.
But an example of this is like where we had to compromise was, and I'm sure you will probably agree with him, 2 is 1, 1 is none, right? So if it's a tourniquet, we sell a med kit with 1 tourniquet.
Not enough.
Right. And that's where we had to be like, well, this gets more bulky. It gets more expensive. Mm-hmm. We're talking about the guy carrying electrical tape. He's carrying none right now. I'm just trying to get him to carry 1.
Yeah.
Because 1 is way better than none.
1's better than none.
And in your and Tier's opinion, that still is none.
Right.
But it's better than none.
Correct.
Now, this is where we get into this with you, where it's like, but should it be 2? And please give us the reasons why it should be 2, because I agree it should be 2, because it should be 1 for you and potentially 1 for your buddy. Mm-hmm. If it's multiple wounds or whatever, but more likely it's a failure of the one, and you need the 2.
Yeah.
Or sometimes I guess, and you tell me this, it may take 2 operational tourniquets to stop 1 bleed, depending on where it's at on the body.
I've received people that have come in that we've had 3 and 4 tourniquets on 1 limb.
Really?
Just because of, the extent of the wound, traumatic amputations, can take multiple tourniquets. Again, are you going to encounter that, in the field as you're out hunting? But let's also recognize the fact. So we go back to motor vehicle accidents and the likelihood that will be your trauma, right?
Yeah.
And we like to think, okay, when we're out, in the field and we're hunting, but how many people now are using e-bikes, ATVs, to get in and out and hunting? So the likelihood, side by sides.
Yeah.
I mean, you get out in some territory you're not familiar with, you roll your side by side, your ATV, you get your legs pinned.
Right. That's a really good point.
So you're seeing more and more of this. We're not humping it back in 12 miles.
Mm-hmm. Horse accidents.
Horse accidents. Right. There's another one. I mean, somebody comes off a horse, and let's say they have a compound fracture of their femur.
Right.
And they're bleeding out. I mean, that's an injury there, depending on location, that you're going to need 2 tourniquets.
The other thing I hadn't really thought of too, right, is like, your hunting partner could be, or your kid, say for example, like if I'm hunting with my daughter Macy, right, kind of relatively small little pencil legs on her. She's a strong little girl, but they're pretty small legs, right? But then you find yourself on a hunt with Bert Soren. Right. So something, somehow his artery becomes cut or punctured and you have to stop the bleed on a leg that's on, someone who's a big power lifter or a big, has a large quad or something like that. So now you're trying to get that multiple pressure down. Yeah, you're going to have multiple.
You're going to have multiple. Mm-hmm. And, going back to being in a motor vehicle accident and sitting there and watching a family member, or let's say you come across the scene of an accident, and you now possess that knowledge. You've been trained and but you don't carry it, on your person, or you don't have it in your vehicle readily available. Like, how do you feel about that?
I thought it was really cool the other day. My daughter Demi came upon a car accident, and she had her med kit, and she unclipped it off her seat and ran over and offered it. As it turns out, they didn't need it, but she had it. And I also was just very proud of her for being proactive. A lot of people will avoid that scene.
It can be intimidating.
Drive off. Yeah. What are you going to see?
A lot of people are worried about the blood and, how are they going to react?
Yep. And so just the fact that she went over, she had it. And, Tier was the one that had said, like, you happen upon a scene and maybe you don't feel like you're qualified to help. But maybe Mike Gerst is standing there with all his training, but he actually doesn't have any, you're in a rental car.
Yeah.
From PA, right, in Montana. Whether or not you did or didn't bring anything with you, I don't know, but let's just assume you don't.
I did.
I'm sure. But you're there with all your expertise, but you don't have any tools.
Right. But that person's there with the tools.
That's what I'm saying. If Demi walks up and hands you the tools, that's awesome. And, even an untrained person with the tools is better than nothing.
Right.
If she puts on a tourniquet and she's not, a level of your training, but at least she knows how to apply a tourniquet.
Yeah. But in those situations, it's also essential, very important to communicate with the people around and understand their backgrounds. Because I have one story where we're flying back, we're over the Pacific flying back, and I just doze off, and you're in that kind of twilight of I'm asleep, but I'm really not. And did I really just hear, is there a doctor on board? Right? It's like I kind of open my eyes, I look, and Heather's sitting across the row behind me a seat, and she's staring at me like, they called for a doctor. Are you going to do something? Mm-hmm. And I'm like, you're a doctor. Right? Like, you're a doctor too. And she raises her hand.
She's like, well, I'm pretty sure they don't need a colonoscopy.
Right. So she raises her hand and she's pointing at me and screaming, he is, right? And I'm like, okay, so I did hear that. Go to the back of the plane, and there's somebody lying on the ground, and they don't look well. But there's somebody already there administering aid. And I'm just kind of watching things kind of play out. I'm an extra set of hands at that point. And there came a point where I'm like, okay, what is this person's level of training?
Right.
And I asked, hey man, what's your level of training here? And he turns, and now I'm me. It's like I'm in a t-shirt and shorts, tattooed up.
Yep.
He doesn't expect a doctor looking like me to come walking back. Right. Yeah. I'm not in scrubs. I'm not wearing a suit. This guy's wearing his, sweater around his neck with like loafers on and, khakis and stuff. So he looks the doctor part. And that's like, don't ever judge a book by its cover. Assume, who somebody is, or what they do for a living. But I asked him, because I'm watching him fumble through this, and he's like, I'm a dentist. I was like, okay, well, that's cool. Like, I appreciate you helping out here, but, you kind of want me, I'll jump in here and take care of this.
Yeah.
I'm an ER doc. And, in that situation, I think most people would say, yeah, man, please jump in, because I'm in over my head. This guy was like, no, I've got this covered.
Oh, wow.
Right. And I go, okay, I respect that. Do you need me now? And he's just like, nope, you can go back to your seat. So I just turned to the flight attendant. I said, look, if they need anything more than a tooth extraction, come get me. I'm in 37C. And
what was the issue?
They went into an arrhythmia, and, older guy that just wasn't handling it. But we're over the Pacific. Where are you going to reroute to? Where are you going to emergently land?
Right.
So it's really just supportive care in, getting him to San Fran to land. So.
Damn, that's crazy.
But that's one of those situations.
It's amazing someone would be that arrogant.
Yeah.
And honestly, even just the liability part of it. Like, I don't know if there is any, but
there's Good Samaritan laws, stuff like that. And there's actually certain states that,
but also if somebody said, but an ER doc offered to help and he refused, that gets a little weird.
That can get a little dicey. Get a little dicey. But, the moral of that story is, communication, at a scene, communication, with an event of who's doing what and what their backgrounds are. Right. Yep. And how you can play into that, and that's all kind of part of the mental preparation and, getting yourself prepared that if you're going to come across a scene, because chances are you're going to. I mean, people are doing a lot of traveling. If they're out, hunting parties, something's bound to happen.
This is actually a very unfortunate situation. I don't think that, somebody like yourself probably would have been, I don't think the result would have been any different had you been there, but we were at TAC in Utah 2 weeks ago, and guy drinking and having fun with his friends, and long story short, he's on a balcony, and I don't know the exact details. There's some rumors, but I don't really want to say out of respect for the family, but he fell off the balcony and, fell on concrete steps and on pavers and, head trauma. And our friend, Bill that owns Spartan Forge, kind of was first on the scene right there. A couple other guys were, and then he stepped in. He had more training from the military, performed CPR, life flighted the guy. And I think they finally got a pulse, but then the next day he passed away. Yeah. And again, I don't know that anyone was going to be able to help that situation, but you also just don't know. Like, maybe that guy could have compound fractured his leg instead of cracking his head.
Right.
you just never know when you could be in Bill at Spartan Forge's position, where it was just he was witnessing it, or it's yourself,
Right. I just think that, as members of the outdoor community, and let's not even the outdoor community, just as like husbands, fathers, mothers, wives, that we take the time, really think about these situations and how we train one another within our own family unit. How do we train our children, right? Because what if it's you,
right,
and it's your, it's my 10-year-old? What if, we're on the trails of my property and, the side-by-side gets in a bad situation and I roll it and, my 10-year-old's the only one there.
Right.
And I'm pinned. Having them trained and prepared, again, is life and death. And I think it's important. And I think as an outdoor community, it's, I spend a lot of time in hunting camps, a lot of time traveling, and my friends are always thrilled that I'm along.
Yeah, I'm sure.
Yeah, they're always.
That's the only reason they have.
Yeah, it's like I could do. I could.
They don't really want you there, other than
no. They're just like, okay, cool. We have a guy with skills, and no, but they're always pleased that I'm there because I just feel more comfortable.
Oh,
like if anything were to happen, but and as I talk to them and kind of mentally prepare and stuff like that, it's also recognizing that there are events out in the field that are just unrecoverable.
Yeah.
Right. You're just there's sometimes, if you're 10 miles in and, you have an elderly guy with multiple, medical problems and they're having a heart attack.
Right.
I mean, there's little in that situation that you're going to do.
Right.
Other than focus on support and comfort. And I think that a lot of people need to recognize how much resource, do you expend, in certain situations.
It's interesting you say what you talk about with your kids, because something I have done for forever is I always talk to my kids when I take them up hunting, like, okay, what happens if we're hiking along here and I have a heart attack, right? Maybe I have a heart attack and die, whatever the emergency is, but I become unable to help you in whatever way that is, right? What are you going to do? Right. And can you find the vehicle? So I was always testing my kids.
I do the same.
About one, can they find the vehicle, or how good of a sense of direction do they have without GPS? Mm-hmm. But as they got a little bit older, like Hank now, he has Onyx maps on his phone. So when we leave a vehicle, he waypoints the vehicle just as I do. Just because he's with me doesn't mean he's counting on me to find that vehicle, right? He waypoints it as well. So, and from a young age, my kids were able to do some form of driving, right? So when I was taking them out hunting at 10 and 11 years old, I was like, hey, what are you going to do? And he's like, well, I'd get back to the truck. And I'm like, well, then what? And he's like, well, I don't know. And I'm like, well, first of all, if it's cold out, one, get in it and start it. Because maybe this isn't an emergency yet. Maybe we're just separated and you're lost.
Right.
Let's just start with that. Mm-hmm. Somehow you're lost, I'm lost. So you get to the vehicle. Are the keys at the vehicle? I never take my keys with me when I hunt.
Yep.
Keys stay on the vehicle. And everyone that I hunt with knows where the keys are at, including my kids. So at least they can get to the vehicle and get warm. All right? That's the first step. And then the second step is, generally, I try to park in a way where they don't have to turn the vehicle around. Right. Yeah. So now that kid can actually just get in that vehicle and drive it out. Right. Maybe it's me getting to the vehicle and I'm in a rush to get them out to a hospital or whatever. Right. So now you can leave that spot fast. You're on some little login road or whatever, and you got to turn around. So can you leave fast? And then lastly, I tell them, you drive off the mountain, drive down. Well, hopefully not off the mountain, but drive down the road, down the mountain, and get to whether it's the first house, the highway, wherever it is that you can find help from an adult, right? Mm-hmm. And that's always been something that I've done with my kids. And it also makes me feel more comfortable, right? Like maybe they do have to save me, And the last thing I would want is me becoming incapable, then causes them harm. They freeze to death, or something happens because I'm not there and they don't know what to do. And they just freeze up. Now let's get into like some and we should talk through a little bit about what's in a medical kit. A few years ago, I was out hunting in eastern Montana with my kids, around Jordan. Sadie shot a deer. We got that one packed to the truck. On the way to the truck, packing it, Hank shoots a deer.
Yeah.
About a mile from the truck. So we pack Sadie's the truck. We get Hank's. We go to get Hank's. Now, by the time we get back to the truck, it's dark, getting after dark. And I went to cut the kind of around the joint and cut the bottom of the legs off of the deer. And he's kind of holding it. And the first one I go through, it cut perfectly, cut it right off, no big deal. The next one I just barely miss, and I'm kind of fighting it, trying to get the tendons in there. And it was all in slow motion. I could see it happening, but he's holding the deer leg for me, and it's all my fault. I'm rushing, and I go through it, and I'm cutting right towards him. And it's like, I saw it all happen before it happened.
Yeah.
I go right through that and right across the top of his hand.
Yeah.
And he jerks back and big eyes on him.
Yeah.
And I'm like, shit. I'm like, give me your hand.
You're just hit by
and I look at it and he takes it off and I peel it open. I mean, I laid him open.
Yeah, gashed him.
Big time. From the pointer finger knuckle right across the top of his hand and across the knuckle of the thumb.
Yeah.
And so it's immediately stitches for sure.
Oh,
and
yeah.
I'm immediately there's not a lot of meat up there.
Right.
And I'm hoping I'm not cutting tendons and shit. Right. So I know he's not going to bleed to death.
Right.
It is in a quote unquote kind of an emergency.
Yeah.
So I wrap it up and we're in no cell phone coverage. We're 35 miles from the town of Jordan. Well, I don't actually even know. And this is something I learned, does Jordan even have an emergency?
Well, so that's part of that preparation type stuff.
Correct.
Where you go
That I hadn't done.
What are your resources, around you?
Didn't know.
Yeah.
So, now I don't know, and I have a decision to make. About 10 miles towards Jordan, I can take a right and go to Lewistown, which is another, 60, 70 miles. But I know they have a hospital.
Right.
Or do I keep going to Jordan and waste a bunch of time to get there to find it's closed, right? So the first thing I did, first house that had lights on, I pull in their yard, knock on their door, just a farmhouse.
Yeah.
And they were super nice. And they're like, yep, we have a doctor in town. We'll call him and we'll just have him waiting for you. Wow. And I was like, all right, cool. And so, and again, not an emergency where I'm life and death. We drive to town, and sure enough, doctor's standing there and a nurse. They're super nice. They bring him in, get it all washed out. They run some tests to make sure that we're not into the tendons. Putting a bunch of pressure on his fingers and having him open his hand and just making sure that, if that tendon popped, we need to know.
Yeah.
And they stitch him up. We're back at the camper at 11:30 at night cooking brats, and it's all good.
Yeah. Yeah.
Just a story. And he has a nice scar today to prove it. Yeah. But I did explain to my kids, I'm like, where Sadie shot her deer, we were a 3-mile hike in, and a lot of people tend to hold a leg for someone they're gutting, right?
Right.
Well, you're trying to run up through maybe with a half-assed dull knife through the hide or whatever.
Yeah.
And up you go and into somebody's femoral artery.
Yep. Yeah.
Or whatever. Without a tourniquet and without all that stuff, you're in a real emergency situation in a hurry. And again, no cell phone coverage, and I didn't even know if they had a hospital.
Yeah. So let's expand that a little further. Mm-hmm. So let's say you have that injury, and let's say it is just snowing, coming down.
Right.
Right. And it's not an emergency, but do you need to get out then?
Right.
Right. Do you need to get on the roads as it's blizzarding and potentially put yourself at increased risk?
Sure.
Right. In having an accident, putting your truck into the ditch with your kids. So how do we manage those in the field?
Sure.
Right. So does it absolutely need sutures? I'll argue every day, no, it doesn't. Right. Do sutures help with, quicker healing? Absolutely. That's not debated.
Yeah. So how long could
is it
I have
necessary?
Gone? If I cut his hand like that, how long? Let's say we make that decision, let's take care of it in the morning.
Right. So a general rule that we say, when you look at evidence, you look at the research, the more delay in closure is the greater increased risk of infection.
Okay.
So if you're beyond a day, it's kind of like, hey, we're We're going to manage it how it is. Now we'll say things about the face. It's like once it's beyond 8 hours, we'll be a little more aggressive. We don't want to have big scars on you. So we'll push the limits of that. But just kind of with the disclaimer of like, this could increase infection. Then you start talking about, okay, are we going to do prophylactic antibiotics to prevent infection and stuff like that? And that's debated as well. Like, do prophylactic antibiotics do anything in those situations? How long can you wait? I mean, you can manage it honestly with some gauze and electrical tape and just reapproximating the wound.
How worried are you about a knife that I was just cutting a leg off of a deer and now it just went through your skin?
Wash it out.
With
and
what?
Just plain water. You have a water bottle, you have a water jug, just irrigate the crap out of it.
Okay.
Just really, really dump it to it. And then, that's another thing, like kits, you don't see a lot of peroxide or small bottles of alcohol. We see alcohol pads, which are good, right? So you can wipe it down with that. If you have the opportunity to really dump peroxide in that situation, like say I'm gutting and I have a blade, in the guts and then cut myself.
Yeah.
Peroxide's invaluable for that situation.
Okay.
Right. But, to put it in perspective.
So maybe you're not going to carry peroxide in your kill kit, or your med kit in your pack, but maybe having peroxide in your truck.
Camp truck, that type of thing. Right. Put it in perspective. When we have,
I'm already feeling like I should take notes. People should start taking notes right now.
So the hand injury laceration thing, it's a weekly text message or call to me.
Really?
Yeah. With pictures like, what do you think I need to do about this? Do I need to go to the ER right now? How can I manage this? And the vast majority of them, I walk them through and say, you know what? Yeah, you can go get a stitch or two. It'll heal quicker, but if you really don't want the expense of the ER or you just don't want, to drive, here's how we'll do it. And they heal.
Yeah.
Right. So, perspective, if we have patients that are in really bad accidents and say there's significant abdominal injury and you develop what's called, compartment syndrome of the abdomen, meaning there's increased pressure in there, it's a closed compartment. So as you increase pressure, whether it's due to bleeding, swelling, whatnot, as the pressure increases, it compresses the vital, organs, your blood vessels, and it will cause, essentially death to your intestines and your organs. When surgeons take them to the OR, they leave those abdomens open.
Right.
Yep. So they open them up. They're left open. They'll heal by what's called secondary intent. Okay. So when we talk about wound closure, there's always the potential of secondary intent.
I'm going to pause right just for a second because this just made me think, and I'm an idiot. I'm texting Tristan to bring one of our employees upstairs.
I already looked at it.
You did?
I did.
What'd you tell
him?
He
already came to me.
Because Tristan came to me and I forgot that I had an ER doc staying in my house.
Yeah.
And
I already assessed him.
He stabbed his hand a little bit with a knife, went in a little bit, but he was saying his
it's numb.
His pinky or his index finger was kind of numb, and I was like, well, let's give it just a little bit of time because it's not some big cut. I said, let's give it a little bit and just see if it was just the initial trauma of it, making it feel weird.
Right.
Let's give it a couple hours. I have to be careful as an employer because I'm not going to tell him he shouldn't or can't go to a doctor.
Correct.
And so, honestly, later in the day here, if it was bothering him at all, I'd tell him go get it looked at.
Go get it looked at.
Because that's the right move.
Right.
But there's no chance this needs stitches or anything.
No, I wouldn't suture that one because it's more of a puncture.
It's a puncture. But what did you think of the...
So I explained it to him. So, he may have he may have hit the nerve. He may have severed that. That's a digital nerve there. I don't have feeling in like 3 of my fingers just from over the years. Or, injuries, fractures and cuts and stuff like that. It's how big of a deal do you think it is? And that's what I explained to him.
Yep. Is there something they can do about that? Can they put that nerve back together?
They can, but I'll tell you what, it's an extensive surgery that, the success of it, you're going through a lot for minimal improvement.
Will it grow back together?
It can. Yeah. So you can have some nerve regeneration. I told him, like, give it time here. He may have punctured it and he may have like a hematoma developing, compressing the nerve in the palm of his hand.
Yeah.
Right. So where he hit it, his tendon's intact. He has full range of motion. That's the important thing. You sever a tendon and you lose mobility of your finger. Sensory is one thing, but mobility is an entirely different thing.
Sure.
Right.
Well, anyway, sorry to derail this, but it was just like,
No.
to me and I was like,
They already came to me.
good Lord.
So
anyway,
it was, as I'm down there in the shop, I was talking to somebody and I just see people start lining up and they're like, hey, can you look at my hand? Hey, I have a question for you. What do I do? I hunt where there's a lot of rattlesnakes. And if I get bit, what do I do about that? So one of the guys was asking me about that.
Yeah. And I want to get to that one, but
yeah.
Anyway, let's get back to what you were talking about. My bad.
Yeah. I can't remember.
You were talking about, like letting a wound just heal, open and healing. And
yeah. So in those, it's, the judgment of whether you're going to pull out of your hunt and how many miles you're going to, traverse to get to an ER. And the first step of that is when you're going to locations that you're not familiar with, know your surroundings, know what's there, what's available. Right.
Sure.
There may not be a farmhouse to go up to and knock on the door and ask for directions.
Right.
So, it's a simple Google search.
Yeah.
I'm in this location, what's the nearby hospitals? And then also recognize that every hospital's not created equal.
Yeah.
Right. Going back to something's better than nothing. And when that's all you have and it's a, little urgent care or, a very rural ED, that's what you have and that's where you go. If you have options and depending on the type of injury you have, you want to try to get to the larger center, depending on what the injuries are, right?
Sure.
Because, that smaller hospital or that very small rural ED, and it may be another 20 miles to get to a trauma center, that small rural ED, likely won't have a vascular surgeon, orthopedic surgeon.
Sure.
And since the whole, COVID pandemic, what's happened across the country with mobilizing, moving patients from hospital to hospital has really become a challenge.
Sure.
So, nationwide, you've watched people sit and wait to get transferred to a larger center just to get worse, decompensate, because they have no beds at the larger center.
Yeah.
So, the law is if you show up to an ER, they have to care for you, irregardless of your insurance, irregardless of, ability to pay, anything. That's our job. That's our responsibility. We have to care for you. But if you show up to a rural ED, with an injury that requires a certain specialist, a surgeon, and they don't have that, they're going to coordinate transport to that larger center. Now it's on that larger center to receive you, and it's when they get a bed available.
Yeah.
So you may sit in that smaller department 2-3. There's people that sat for a week.
Well, and also, an example like Hank and I are leaving next Saturday to go moose hunting in Canada. So once you leave your country, there can be also different rules and different protocols in different countries too. Going into Canada is, better than, maybe going into Africa somewhere.
Right.
From a medical perspective, but even knowing the differences in country of like what kind of care is there and what does your insurance transfer to those places and what that looks like.
It's always a good idea to alert your insurance that you are moving, that you're going to be going elsewhere.
Yeah.
Just to avoid that on the back end. Mm-hmm. So they don't end up denying claim and
sure.
You're paying all out of pocket and playing that game.
So, your average day pack, I'm going to say elk hunt.
Yeah.
1, 2, 3 days, whatever, out hunting. What should be in your med kit?
So, what's in my med kit is going to be different than what's in, everybody else's, because again, it comes down to training and what you're capable of. So what I'm capable of doing with, a mini goat, right. Like that type of thing.
Yeah.
But I think the everyday person, honestly, what's in your everyday kit, it's fine to have gauze, to have tape, the tape, whatever you're comfortable with, I'd say is my greatest advice, but train with it. Well, don't just buy it and let it sit.
And also people should know, like, there's gauze, but then like what comes in our kit is like the blood clotting gauze.
Right.
Like maybe for wound packing, something like
combat
that. Combat gauze.
Yep.
So, you could maybe get a little bit, if you're not getting our kit, but you have a kit, maybe you could get a little bit higher level type of gauze where it,
right.
Cause that combat gauze reacts with the blood, correct?
Correct. And it's going to form, it's going to help you clot. Mm-hmm. So, if you get into a situation where, look, I'm in areas, I've been in areas hunting and in being in Pennsylvania, it's not, big, expansive tracts of land. You're hunting, small postage stamp properties where, you may be a couple 100 yards from another hunter.
Right.
They get excited and they shoot and you end up getting shot.
Yeah.
Right. So you catch one through the thigh or you catch one through your arm. I mean, that's where combat gauze really comes in handy, right? You're just going to pack it into that wound.
Okay.
Let's say, your archery elk hunting, and, you slip and, you catch an arrow.
Right.
Right. And, that combat gauze is going to be, essential.
That just happened on the Alone TV show. I'm behind on it right now, but it was probably a few episodes ago at this point. But guy had an arrow fall out of his quiver.
Yeah.
He's walking along.
Happens.
And it went 2 or 3 inches into his leg.
Yeah.
And he ended up having to tap out. I mean, right in the beginning of the show, really. That happens fairly often. The other thing that I think is very common, and I've had very close calls but never had an issue with it. I've had small punctures. But, in elk hunting country, you tend to be crawling over and walking on a lot of logs.
Right.
And on those dead trees are a lot of broken branches, sharp branches, and you're walking a log and then you're jumping off down into brush that you think maybe is clear, but little do you know, you might run a really sharp branch right up through your calf.
Yeah.
Or into your leg somehow, or fall and have it puncture your stomach area, chest area. In our kit we have a H vent or a high vent chest seal.
Chest vent. Yeah, chest seal.
Vent. Chest seal. So like for a sucking chest wound, right? Explain what that is and why you might want to have one of those, or would you have one of those?
No, I would. I mean, and again, it's, it comes down to training and having it in your kit, understand what it is and how to use it. And I think a lot of people will buy kits and feel that comfort and security of, hey, I have a kit on me. But when it comes to the moment of, hey, I need to use this kit, they don't know what anything is in it.
Yep.
And I've seen that play out. People are just rifling through the thing. Those chest seals are made, when you look at your lung cavity and you get a wound that punctures your chest cavity. As you're breathing in, it's a closed system, right? So as you're breathing in, it's sucking air into your chest, essentially collapsing your lung. So now you have a buildup of air around your lung in your chest cavity. And the ultimate risk of not managing that is that air builds up and gets trapped into your chest. It compresses the lung. Then it starts shifting over your heart and your big blood vessels, and it just collapses those, and you go into cardiac arrest and die. So the purpose of the chest seal is to create a vented system. So, when you're breathing in, you're not sucking air in to your chest. As you breathe out, it's expending. As your lungs trying to expand, it's pushing that air out through the seal, right?
Okay.
So you breathe in, you're not sucking air in because that seal will collapse on your chest, right?
Okay.
Does that make sense?
Yep.
Yeah.
Yep.
So that's kind of the mechanics of it and the
Can
physiology.
that chest seal be used for any other type of wounds or reason?
I think you can use that for larger wounds just for a covering. But, I would recommend, what we oftentimes see in these kits are the little 2x2 or, 4x4 gauze packs, right? I think what's a better option is the rolled gauze, the rolled Curlex gauze. It's not adding weight to your pack. It's a little bulkier, but it's not adding a lot of weight or anything like that. And what you can do with that can go anywhere. Simple wounds, large wounds, compression bandage, that type of stuff. Sure. And electrical tape. I'm just a huge fan of electrical tape.
Yeah.
I think it's far better, especially outdoors, just because of, water repellent, really protectant.
Yep.
Right. So versus the cloth tape.
And you can get it really tight. I mean, stretches. I mean, frankly, you can cut off a lot of circulation.
You can.
It.
Right.
I mean, it's not going to form as a tourniquet, but it's tough.
Yeah. What I see in a lot of the kits are the traditional like cloth or paper tape.
Yeah.
Right. And now you're in a cold, wet environment. How long is that lasting?
Yeah.
Right. What type of protection are you getting as that gets like soaked?
Yeah.
There's no more compression. So I'm just a huge fan of electrical tape.
And with that electrical tape, I mean, it's in there most likely for here, you have to attach tags, right, to your carcass. So
the utility of it is just
to be able to tape a tag really securely onto like the antlers of an elk or a deer.
Yeah.
And like you say, tape it all the way around it to seal it off from moisture.
Yep.
If your tag is something you printed off at home that's not on waterproof paper,
Yeah.
you can really tape it up good.
So many utilities for electrical tape.
Yeah.
And that's what, the first time
Around
around
the bottom of your, even your rain gear, if you don't have gaiters, tape up around the bottom of your rain gear. It keeps your rain gear from sliding up and getting your socks wet. I mean, it's just so
tape
many.
around it. Yeah. Tape around your, pant legs, anything. I mean, you use it for anything, and it's got its medical use. First time that I had a buddy, text me that he cut himself pretty good, and I gave him that direction. Well, let's wash it. Number one, let's cover it. Went through, on FaceTime, and had him do the exam for me, make sure there's no tendon, stuff like that. And then I'm like, all right, so we're just gonna take some electrical tape. He's like, what?
Yeah.
I'm like, yeah. I'm like, why not? You have electrical tape, right?
Yeah.
Because he was going to run to, the pharmacy or a Walmart and buy, the cloth tape and stuff. I'm like, you have electrical tape right there. Why do you have to run?
Yeah.
So
in a kit, then a tourniquet, right?
Yeah, absolutely.
Or two.
I would say, I'm just more proponent of taking two.
Mm-hmm.
I don't think that it adds a tremendous amount. It doesn't. Just a name drop here. I use a tourniquet by Snake Staff Systems. It's super compact. They've done independent research on it. As far as success with the tourniquets. It's really it can be an EDC type tourniquet that you wear right on your belt. And
can you train with it and count on it for use? A lot of times they say, hey, if you open a tourniquet up and you practice around the dinner table with your children, then can you put it in your hunting pack? They always say take a new one.
Take a new one. I always say take a new one. So when you're buying, I mean, again, these are not ridiculously expensive, and oftentimes you'll find some companies that you're buying two at a time. You can use one just for practice at home, which I encourage. So I would buy one just to have it home to practice with, wife, husband, kids. Leave it there for them to continue to practice, and have one that you're putting in. Don't just buy one. As I said, you should have one in every vehicle.
Yeah, it's more like buy 6 or 10.
Yeah.
I mean, depending on how many vehicles you have.
You're buying these by the dozen.
Right.
Right. You're not, if you're logging on and buying one tourniquet, you're not doing it right. I mean, you should buy a dozen of these things. You should have them in every vehicle.
Yeah. If you have out in your shop or
if you have a teenage driver, you should have it in their vehicle, in your pack. I'm just not somebody that I'm going to jump out of my truck, remember to take my kit, throw it in my hunting pack, go out. So I just have multiple.
Well, and if you do apply tourniquet, watching videos online now you actually have an Instagram page you've started. It's Prep 'em
Wild
at Prep 'em
at Prep 'em Wild. Yeah.
And is there a website yet?
No website yet.
Or like training videos or anything yet?
Not at this point.
Kind of beginning this idea.
Yeah, in the infancy, beginning this. And this just came about through multiple people kind of encouraging and saying, you're doing this stuff for people. Why don't you benefit from it? And the type of person I am, it's really hard for me to ask for anything from people. You know what I mean?
Yeah.
It's just kind of, I guess that's my most toxic trait. I'm just there. I want to help people.
Yeah.
I genuinely just want to help. So, it's weekly, I'm getting, hey, can you look over these labs? Can you do this? Can you do that? So I've just had a lot of encouragement from people saying, man, why don't you actually create something with this?
Yeah. Cause even like a quick cell phone video on how to apply a tourniquet.
Yeah.
How to put it on yourself.
Yeah.
How to put it on your friend. On a leg or an arm or whatever. And then also even like little things about like, okay, you've put it on your buddy and you're somehow hauling him out of the mountains.
Yeah.
Stopping occasionally and checking that tourniquet, making sure, one, did you lock it in position well?
Yeah.
Is it still locked in position well? Has it shifted?
Reassessment.
Yeah. And then the other part of it is we all had to do it when we've done some of these trainings. Actually buy one, like you just said, to practice with, and then put it on until you've actually stopped that pulse in your arm. And it's painful.
Yeah.
Like you will see.
Doesn't feel great.
It's not, you're not putting it on to a level of tight. You're putting it on to a level of, it's painful.
Yeah.
Especially on the leg, man. I mean, it can
does not feel good.
Really crank it down. And then where in relation to the wound, right? What do they say? 2 inches up from the wound?
Above the wound, always above a joint, never across the joint, and as high as you can get above the wound, right? So if you have one mid calf, right, or lower calf, you can go up to the upper calf right below the knee. If you have one thigh, you're going to go up, as high on the thigh as you can. You want to get to that proximal point of it.
So there's that with tourniquets and again, even it sounds simple, like applying one to your own arm, but maybe when you go to tighten it up, are you pushing that tail away from yourself or pulling it into yourself, right? So learning how to put those on, yep, and position it in your hand, so when you put it on, you're pulling that tail into it yourself, and you can run the little, what the hell do they call it, screw lever thing, the windlass, yeah. And then locking that windlass in.
So, that's kind of how the concept of Prep'em's, born. Just a lot of people asking a lot of questions like that. And then the encouragement of hey, you have knowledge, you're in the outdoors, and, there are a lot of physicians that are in the outdoors. I'd say that, we're minority. Mm-hmm. I don't work with a lot of people that are going to Newfoundland in the middle of nowhere to chase moose and caribou. Right. I can think within my system, I'm the only one doing that. Right. So I think there's a connection there of, kind of real life emergency medicine and how that's applied in the outdoors, and, how we can better prepare, not put ourselves at risk and not put our hunting party at risk, and actually be an asset. Right. Yeah. Be an asset in the field, and, don't create risk.
Well, and, okay, let's say you think you're a pretty capable dude, kind of, arrogant about your abilities and whatnot. But
there's arrogance and there's confidence.
Yeah, but let's just say you are not you, but a person is kind of arrogant about their abilities, and for no good reason, right? They just are a man, right? And I'm capable and blah, blah. But what if? Okay, well, I don't care if I get cut or I'll just whatever, but what if it's your hunting partner? Right. What if you can't actually properly care for your best friend, right? Your wife, your kid that's with you. What if you're a guide? I have been blown away when I've been at hunting camps.
That's an industry there.
It boggles my mind, because these guys are taking they don't know who's showing up to camp. Right. This doctor from PA is coming. Right. Is he Mike Gerst, and he's physically fit and capable and a good hunter and also knows his shit? Or is it a lawyer from PA that's 80 pounds overweight and never actually been above 500 feet in elevation in his life? Right. And has no idea how to walk on uneven terrain, has no idea how to do anything, and you don't have a med kit.
I've never seen one.
No, neither have I. And I ask guides, what do you have for med kit shit? Just because I'm curious, and it boggles my mind.
Right, and I approach that situation in not being this arrogant asshole criticizing what they're doing, right? Because they have a tough job. Yeah, but it's kind of within the industry there. It's just not kind of established practice. Yeah, which has been mind-boggling to me, and why when I travel, it's like I've got everything I need with me. Right. Now I've got, scalpels and, nasal airways and staplers and sutures and all that stuff, because I'm not going to pull out of camp. Right. For certain things, there's going to be things it's like you've got to pull out. But, if you've got a laceration, we're going to manage that right here, because we're not. Right. Look, I get all but 9 days off a year to go, hunt moose.
We're going to black tape a tampon in that thing.
Correct.
And keep hunting.
We are going to keep hunting, fellas. So we're not pulling out and heading to, an ER that's 6 hours away. Yeah. Not, so we're going to manage this the best we can.
What about the guy that goes, well, I got a speed goat, I got paracord, I'll just make a tourniquet with my paracord?
Well, so, there's kind of impromptu, tourniquets. And when you look back through history, that's what a lot of people did, right? Cut their t-shirt, grab a stick, wind it down, and say it's just not
how much
necessary.
Time do you have for that? And that's
times of the essence. So
that's my question, right? So
you have a femoral artery
and
significant injury.
You have a speed goat.
You bleed out in 4 minutes.
And it takes about that to unwrap your we tie the knots tight on these speed goats. Right. So it takes you however long to fumble with getting a knot
You're
undone.
gone. You're gone.
You're untying that thing. Okay, now you're trying to wrap it around there. You're going to tie a loop on the end and something like, how are we going to get it tight? And then what are you going to spin it with? Now you're looking for a stick, or something like
not necessary.
What, like, is it even really possible, truly, to do that and save a guy's life? Like, it's
depending on injury. I'll say that it's impossible. I won't say that it's impossible.
But it's highly unlikely.
Highly unlikely.
If that tourniquet isn't just being put on a bad cut, but if it's actually being put on an actual arterial cut or hemorrhage of some kind, I mean, artery bleeds, which I've never even been around, I'll be fully honest. But I mean, just from everything I'm being told about, when you actually cut an artery,
they're quick.
Are you going, and now you have the pressure. You're trying to unwrap that paracord, or you're trying to dig it out of your pack, and you're trying to make up a makeshift, unless you've really practiced a ton and you have a system. The other part of it is okay, let's just say you succeed. You wrap that paracord, or because I've heard this a lot, like, well, I'll just wrap cord around or a t-shirt.
See, but paracord's just not a good material to do. Right?
So that's
so
what
it's
I'm
so
getting
narrow
to.
and constrict. You know, it's not that wide.
So the damage to the skin, let's just say you do it, but with
you wind that down, you're just gonna you can potentially lacerate through the skin and cut down even further, cause far more trauma.
Let's say that paracord now has to stay on that arm for an hour and a half.
Yeah.
To get to a hospital, right? You've cranked that paracord down. It is 100% going to cut through that skin.
Yeah, I've unfortunately seen it.
Have you?
Yeah. I see people do makeshift stuff and they just use, clothesline, paracord, whatever. Because they just don't have, a tourniquet available.
Yeah.
And now you've created a scenario where now you're doing surgery upon surgery.
Right.
Now you have to get, that paracord off, or that cable, or, clothesline or t-shirt that's buried in there. And now you've caused more localized trauma.
And how many times do you have guys come in, or someone come in with a tourniquet on a cut that actually didn't need a tourniquet?
A lot, right? Because that's our training, though.
But now you've provided, you've caused damage from a paracord tourniquet that
correct
on
it
a
wasn't
wound
needed.
That didn't even need the tourniquet. Had you just put a real tourniquet on, hey, better safe than sorry, fine. But you didn't cause a bunch of trauma,
right? That
was unnecessary. So yeah, I'm not worried about causing extra trauma. If the guy really needs a tourniquet and I don't have one, crank paracord or whatever down because it's life saving.
Yeah, you'll bleed a lot. Your cephalic, your basilic vein here, kind of in the crease of your forearm.
Is that where usually they
draw
like
blood?
Okay.
Yeah, so they'll draw blood to your antecubital, your cephalic, your basilic, but you get a laceration across there. They bleed like stink, right? But I mean, I know the difference, being in this long enough. But we'll see a lot of those lacerations across those veins. With tourniquets applied.
Okay.
Just because it's a lot of blood, right? It's not as high pressure, though. Like when you get an arterial bleed, there is no mistaking it. It's under high pressure, that really bright blood, not that dark maroonish color, and it's not just running out of you. I mean, it's pumping.
Yeah.
I mean, it pumps. So, the first thing that we do when we have tourniquets, come in that are applied is we take it off. We loosen it.
Yep.
Right? Because I'll loosen it, and then if that starts spraying, across the room, we know, right? It's arterial. There are some situations, we're in a rural area, so, farming accidents are prevalent. Somebody gets a sleeve caught in a PTO. I had that on a 2-year-old. Was with his grandfather and went around the back of the tractor. PTO's fired up, and his shirt sleeve just got snagged in it and just took him off right at the shoulder.
Oh God!
And that's one of those situations that during that time, you don't have you didn't have interventional radiology as prevalent to where they could go into the arteries, and it's like you literally have to stand there, and it's like you watch this little guy go. Those situations, whether we're hunting, we're driving, you've got a farm here.
So he dies from that because you just can't stop the bleeding.
Can't stop it. It's just, when you get really proximal injuries, when you get up into, like, say, the groin area, you have a severe groin injury, that artery will retract up into your abdomen. You just can't get to it.
Yeah.
Tears taught me something cool down at Winterstrong that they did in the field, which I've never attempted, I've never seen, is, those really high up injuries and applying a tourniquet, kind of put 2 tourniquets together and then put a full water bottle right over the groin there to compress the femoral artery and tighten it down, with that bottle there. And it worked. So sometimes you have to improvise as well, and you have to think on your feet. And that's one of those situations that he told me. I'm like, that's good. That's good work right there.
Damn.
Because I know a lot of people that would stand there like, well, we can't get to it, and you can't put a tourniquet on the groin.
Right.
It's too high up. So that's pretty, that's pretty cool.
So some of the common injuries, that one came up downstairs. Let's do it. Snake bites.
Snake bites.
I'm a guy, I live in Western Montana, and we have some garter snakes, nothing that's going to get us really here. But I've been over in the Missouri River breaks in eastern Montana. I killed a couple rattlesnakes over there. One of them's on my wall. Shot it with my bow. It was kind of fun, but it scared the shit out of me.
Yeah.
Walking back to my camp after elk hunting. I also found myself chasing some bulls one day and just running, trying to get ahead of them. They were heading up a draw, just kind of feeding up into the timber to go bed. And over there, it's not big mountains, so it's just like you can just go.
Yeah.
And I'm running up this ridge, and I'm jumping logs, and I'm just trying to just get. And like it kind of hits me like mid jump, one jump over a log, like, oh shit, I'm in freaking snake country. Like this isn't Frenchtown anymore.
Yeah.
And you were telling stories about at your house. You guys have a lot of rattlesnakes.
Yeah.
So you get bit by a snake. What do I do? I'm in eastern Montana, not out of cell phone coverage.
Well, you get bit by a snake. First thing, get away from it. Right. Yep. So I think a lot of people panic and will remain in close proximity, recognizing when a rattlesnake's startled, a lot of times they'll dry bite you. Right. So out of reaction of like you jump over that log and they're caught off guard, it's just like quick wham, just warning, and they're not injecting venom. So the first thing is get away, remain calm. You don't want to go on a dead out sprint trying to get out of that draw, get back to your truck and, get your heart rate up and venom pumping through your body if he does inject you. You're going to have to call for help. You're going to have to, get on your phone, 911, however you're going to get out of there. But sit down, get a neutral position, so which injury sites.
Pausing there, as far as the phone, like I'm out of cell phone coverage. This is where it's a good point to say an in-reach is priceless.
Oh, yeah.
People... Yes. I'm telling you, and you can turn your plan on and off.
Yep.
Right. So, and there's another thing I do with my inReach I'll get to, but the technology with an inReach and to be able to hit an SOS button, the whole being out of cell phone service now is not an excuse. It's not a good enough excuse. When I grew up, that was the excuse, and it was legit. Get an inReach or some kind of a device where you can have satellite communication to emergency services. The other thing I do with my inReach, again, hunt a couple weeks out of the year or whatever it is, couple months. The rest of the year, that's usually in my truck because we do a lot of driving in Montana out of cell phone service. So you're paying for this thing. It's in your truck. The other thing I do is it also sits in my, I take it in my backpack on all my trips.
Right.
And this is out of a little bit of a weird, I don't know, prepper mentality or into world or whatever. But like if I'm traveling in Nashville or New York or whatever, and all shit in this world hits the fan, you lose all electricity or cell phone towers or whatever happens, a 9/11 style event and towers are down or whatever, I have the ability to still communicate through that device to my family, right? And even slight navigation abilities on that. So anyway, that's the thing. You can use that inReach beyond your hunting. Just like your med kit, take it out of your hunting pack and put it in your vehicle. So anyway, sorry to interrupt you, but back to the bite. You've been bit.
You've gotten yourself away from it. There's still misconceptions of, you apply tourniquets to bite sites, and we don't want to do that.
Okay.
So you don't want to apply a tourniquet. You don't want to, put pressure on it. you can bandage it up. That's fine, but don't put a big pressure bandage on it or anything along those lines.
Do you get your hunting buddy to suck on it?
No. So we don't do, so you'll see, I'll mess with you. Only if I'm bitten the ass.
Depends on where it's at.
I'm bitten the ass. I'm going to ask you to suck on it. No, just to mess with you. But no, so you still see some of these kits being sold with, a little tiny razor blade in it and a suction cup and a syringe, to suck the venom out. And there's just no evidence to support that.
Okay.
We don't do that. So we don't tourniquet, we don't suck it out. It's really, in that instance is, remaining as calm as you can, right? You're not going to pop caffeine tabs. You're not going to sit there waiting for help and start drinking coffee.
So your answer really is kind of,
you're going to
do nothing.
You're going to get to
other than
anti-venom. So really the only evidence-based approach to snake care is anti-venom.
So try to get yourself from wherever you're standing to anti-venom in the most calm and relaxed way possible.
Calm and relaxed, yep. Calm and relaxed. Like I said, caffeine, you're sitting there and you're going to, take some energy drink, to get yourself back. That's just a bad, bad idea.
I think Travis asked about, was it Benadryl?
Yeah, Benadryl. I honestly would have to research it further. I'm not familiar with Benadryl use in snake bites, other than perhaps, Benadryl combating a histamine response in the body, just as if you were bitten by, stung by a bee. You get that, that hive and, the histamine response and the itchiness. I don't think it hurts, but I can't be 100% positive, without looking at it further. I can't think of anything chemically that would hurt it. But, medications you don't want to take would be ibuprofen, Advil, Aleve, what we call NSAID, non-steroidal anti-inflammatory medications. You don't want to take those.
Why is that?
Because it can thin blood.
Okay.
Right. So
aspirin too. Correct.
You don't want to start, take aspirin for the pain because these are uncomfortable. People that come in with these, they're very uncomfortable. So if you have Advil, Aleve, aspirin, not a good idea because that's going to thin your blood and you're going to hemorrhage more.
Is there any painkiller you can take that doesn't?
You do Tylenol. You do Tylenol. If you have prescription pain medications, they're fine as long as they don't have NSAIDs in them. Right. So Toradol, you don't.
What about like an oxycodone?
Oxycodone you can take. Yep, that's fine.
Okay.
That would be fine to take because it is painful.
That's another thing in my hunting pack. I do have a bunch of leftover pain pills from various surgeries, back surgeries and different stuff, hernia surgeries. And I'm really anti on taking those. Those they don't make me feel good. Like I get queasy. I want to throw
nauseated,
up. Yeah, I don't like them. So like I had my disc surgery done in my back, and I never took a pain pill. I was taking a bunch of them before my surgery, and they weren't doing anything. But I was trying because I was miserable.
Right.
But I actually do keep some of those in my hunting pack for, say, I broke a leg, right?
Yeah.
And I'm waiting for you to just go get help. Maybe it's not a life-threatening situation, but I've fractured a leg, and that sucks.
Well, and that's a great idea. The problem is, getting those, controlled substances, those medications.
And that's why I'm saying, like, I'm not advocating people go try to buy them off the street or do something. But if you have, most of us have something around that we ran out of. Because most people I know, when they don't need them anymore, they stop taking them.
Right.
And probably the right move is throw them away. But so kids can't get them or whoever else. But those of us that do have those, I don't think it's probably a bad idea to have a few in your hunting pack.
Well, I mean, I agree. So, along the lines of, medications and what medications, I think the ultimate, hunting pack includes medications in it.
Mm-hmm. So what medications?
EpiPen, number one. Okay. I mean, that's the number one.
I don't have that.
That's the number one life-saving intervention.
I learned something. I didn't know this. So I generally think of EpiPen as an allergy thing, right? Mm-hmm. Well, I don't have allergies. My kids don't have allergies. Right. So I don't carry one. But when they were trying to revive the dude in Utah,
adrenaline,
when he fell, they were hitting him with an EpiPen.
Yeah. So, epinephrine out in the field, without, advanced equipment.
Right.
What do you, what's the end game there?
Right.
I guess. So if I get to the point where I'm administering epi, you're having a heart attack, I'm giving you epi, I don't have a means to intubate you. I can do CPR, can't establish an airway. I don't have a bag valve mask with me, that type of thing. So, you start administering epi, and how much epi do you have on you? It's kind of
right. So what's the EpiPen for other than allergies?
Allergies.
Just pretty much that.
I mean, I'd say in that situation, it's more allergies. I mean, you're not carrying epi for the cardiac arrest, and you're going to work a cardiac arrest out, in the middle of nowhere.
Right. What other medications would you have?
Essential antibiotics. I think, if you're going to be in camp, if you're going to be remote, and let's say you do cut your hand, you take the option of, hey, let me, bandage this, see how it goes. And 3 days into it, you start noticing some redness. It can prolong your hunt.
So how do you get those? Because don't you have to be prescribed those?
You do. And now there's various companies around the country. And this is one of these things that I thought about years ago. And then I start researching it and realize there's now these pop-ups that are doing it. And it's like
you should have done it
a little too late, right? Like there was my toothpick idea. I always look at the toothpick as like whoever invented the toothpick. I mean, it's so, they're Post-it notes, right? So you've got various. So there's Jace Medical, right? There's Duration Health. There's Contingency Med, are three that I'm familiar with. And when you look at those, they come in a little kit, and it's really just a telemedicine visit with a provider, and they prescribe that to you, and it gets shipped to your door.
So if I'm like, hey, I'm going to Canada on a moose hunt,
yep,
and I'm just a little nervous, I'm going to be out of on horses for 10 days,
yep,
and I could cut myself.
Well, not only that though. So going back to your like prepper mentality, let's look at just a few weeks back. There were in multiple states pharmacies were down.
Right.
You can get medications filled. So what happens if that goes to a week, 2 weeks, and you have essential medications that are not available now? Right? Yeah. So we're fortunate because we can just call in those essential medications for ourselves. But people that don't have a license and can't do that, what do they do? So I think these companies have popped up, recognizing that the world's in a challenging space right now. And I don't think a lot of them are geared toward, they're not focusing on the hunting industry. It's more like the prepper mentality, so it's not like, I'm going on a hunt type thing. But
are those antibiotics are just pills?
Yep.
And is there any shelf life on this stuff?
I think 2 years, I think, is what they advertise on their sites. Right. As long as it's in a dark, cold place, not cold, but you're not storing it in your garage in 120 degrees.
Right.
Just
what other kind of medication in your hunting pack?
I'm always taking Zofran with me.
What is that?
So that's an antiemetic, an anti-nausea medicine, right?
Oh,
so that's something that
you get air sick or car sick?
No. So let's just say in travel you get some bad food or something along those lines, or in travel you're exposed to somebody with the GI bug. I mean, how many people want to wait the whole year to go on their hunt, and on day 2 you're like vomiting.
Right.
And miserable,
right?
Like don't even want to go out. Like me personally, it's like, I'll take Zofran and keep pushing through, because again, it's like I wait all year to get to Newfoundland the moose hunt. Yeah, I don't want to cut it short for something.
So it's just a nausea medicine. Does it also help with air sickness or?
Yeah, it can.
Or because man, I get I'd love to be a deep sea fisherman, but
meclazine's
barf every time.
So meclazine, Zofran. They can both work. I think meclazine's going to be.
And then every time I go south of Texas, I end up shitting through a screen door.
Yep. So we talked about that before.
Yeah. Well, I came home from our trip, and then you and we met up down at UFC fight.
Yeah.
And I'd been home like 10 days, and I'm like, dude, I still got terrible diarrhea. And you're like, bro, you should have been to a doctor a while ago.
Right.
Was it traveler's
diarrhea?
Yeah.
Yeah. So that's one of those things that you're on a hunt, and let's look at Alaska, right? So let's look at Alaska at certain times of the year where you may be going in, by plane, being dropped off in a spike camp, and now weather moves in, and they can't come get you for another week.
Yep.
Right. So, and something happens, you start getting a fever, it starts burning when you pee, whatever, and you're stuck. Like they're not getting to you. So, I guess that's part of the prepper mentality, and just looking at the, simple ways of managing in the field.
Yeah. Any other medications?
Antibiotics, epi, Zofran are the big ones. Pain control, I would say Tylenol, ibuprofen, some basic wound care medications like a Neosporin, bacitracin, something along those lines.
What's the difference? Why would you take a Tylenol versus an ibuprofen?
Mechanism.
Besides the blood thinning part of it.
Blood thinning mainly. So Tylenol, NSAIDs are more processed through your kidneys. So if you're somebody that has like kidney disease or borderline kidney failure, you shouldn't be taking a lot of NSAIDs. Tylenol is processed more through your liver. So if you're somebody that's a heavy drinker, perhaps cirrhosis or, teetering on the side of cirrhosis, you shouldn't be taking Tylenol.
Interesting.
Yeah.
Interesting.
So it's kind of the mechanism in the elimination from the body. And then side effects, NSAIDs will, potentially cause more bleeding.
Yeah. Do you have, and this really isn't emergency medicine stuff, but like tips or tricks for like blisters?
Oh, yeah. Figure those out. So I'm a fan, like blisters.
You want to talk about stopping a hunt. If you're
right. Well, that's
terrible blisters. God dang.
Well, and that's part of the preparation of getting ready to go on a hunt, and like get your boots early and put them on and hike in them.
Yeah.
See if, you have blisters. Moleskin is fantastic to use. If you're somebody, if your boots just aren't right, find a good fitting pair of boots. There's so many out there. You're going to find, I've had bad boots before and I've gotten blisters from them. I typically will cover with a moleskin. It's like a secondary skin that really, you'll see athletes use it for stuff, right?
Right.
But the important thing is, like, when you notice a blister, don't pop it. A lot of people have a tendency, they want to pop that thing. If it's going to pop, it'll pop on its own.
Because it's fun.
It's fun. But if they're gonna pop, they'll pop on its own. And the reason behind we don't want to pop it is because underneath that blister, it's starting to try to heal.
Okay.
Right. So you have new skin cells, growing, healing. So when it does pop on its own, you've already got that skin kind of regenerating there. Right.
Yeah.
And you're going to be better off for it. And you don't open it up for infection.
Do you carry anything or, again, this may be something in a vehicle versus, obviously in a regular pack, but like for burns, like what do you suggest for burns?
Burns, honestly, for burn management, even in the emergency department, it is a simple Neosporin or even Vaseline and protective gauze. That's it. So so I see some kits that they're putting Silvadene in it, and Silvadine's expensive, it's messy, and there's really no benefit for a burn like that. Silvadene is honestly reserved for like burn centers, right?
Do those aloe
can help with the discomfort.
Bottles help?
It can help with the discomfort, the burn, sunburn, stuff like that. So when we talk about being in the, being out in the field hunting and stuff like that, exposure is usually what we're dealing with, right?
Yeah.
Whether it's heat exposure, cold exposure, sunburns,
right. You can get burned really bad, actually, even like just in snow.
Yes. Yep.
It's kind of crazy.
Yeah. So, that's a good question too. Like, how do we deal with those burns? So, simple, sunburn, aloe can help with the discomfort. Now we're starting to talk like we're going to be carrying a whole pharmacy on our back at some point.
Yeah. And I'm not necessarily talking some of this stuff about carrying, but like,
just keep it.
Maybe you're going
camp. Keep it in your
over the counter mule deer hunt in Arizona,
right? And
you're a redhead, right, or a blonde, and you got white ass skin like I do.
Yep.
I do tan well over a little bit of time, but boy, if it's an initial hunt out of the box and I'm not
I'm burnt.
Yeah, you can cook yourself out there all day long glassing for mule deer.
Yeah.
So again, maybe this is stuff you put in your truck for a specific hunt. Just like going to Arizona, I'm going to have some aloe or something like that in my truck, or in a bag in my truck of just like possibles.
Yeah.
Even my moose hunt that we're going on in Canada, I'm packing a bag of some of that kind of stuff. Not that exactly, but some extra things that are going to probably stay in my truck when I get to camp. But when we come out of camp or even on the way up there, in a vehicle, 26-hour drive, things can happen, right? And so I might have some survival type stuff or whatever, medical type stuff in my vehicle that I'm not necessarily going to put in my pack and take into camp.
Yeah.
Yeah.
You got to think about what you're going to lug around.
Right.
How much, how much weight and space that you want to have versus, have something within proximity, in camp, that you can use.
In regards to treating your water, that's another big thing. My mom, when I was young, she got Giardia.
Yeah.
And got really sick.
Beaver fever. Yeah, beaver fever is real.
And then for her, it turned into chronic fatigue syndrome.
Right. You get really sick.
She got bad. I mean, she was hospitalized.
Yeah.
It was bad. And it actually messed up her equilibrium for the rest of her life a bit. But do you carry tabs? Do you filter?
Boil.
Boil.
Yep. Boil water. I don't carry a lot of tabs or filters. It's just another thing to throw in there. I don't. I know a lot of people that do, and that's fine. Life straw, those types of things, and that's fine. But, boiling your water just gets rid of everything.
Yeah. One of the last things that I have, and then I just kind of want to open it up for some other things that maybe I've missed that you've seen or you get a lot of questions about. But this really has nothing to do with hunting. This is just more of a general men's health question about TRT.
Yeah.
It's been a popular topic in the last number of years, and you hear a guy like Rogan talk about it a lot. You talk about other people, and you kind of hear like, oh, so-and-so is taking testosterone replacement therapy. And like, well, no, that's only for old guys, or
right.
You're going to get prostate cancer if you take it, or, your balls are going to shrivel up or whatever. Yeah. Right. What's your take on TRT?
Yeah. I mean, this is my personal opinion with it. Right. I think that there's certainly, people that benefit from it. Right. And then there's the other population, just because it's readily available and they think they want to get jacked, right? That it's so readily available now that you can go on,
pull that thing up,
many of these websites.
Right.
Right. And these companies that have popped up, and it's like prescribing to 18-year-olds.
Yeah.
Yeah. That's a dangerous path, because recognize once you start TRT or HRT, you start doing testosterone, you're committed for life. The likelihood of you getting off that, the longer you use it, and then your body kicking back in and producing its own. Like, let's say, you have a young person that, I'm going to use this for the next year or year and a half to get jacked, and then they come off of it. Well, you may not produce your own testosterone then,
because your body just doesn't have it just decides, I don't need to make
I don't need to make it. Right. Yeah. So your balls shrivel up and they become dormant, and, they may not kick back in again.
Yeah.
So I think there's certainly a time and place. We talk about numbers and what are normal values. And again, these are ranges, recommendations for it. So, you look at, some of the ranges are anything less than 200 or 300. Some of the companies will, reference, okay, less than 500, you should be on it. So there's a spectrum of like what's normal there. When I think it's more like, how are you feeling? Right. I know a lot of people that, they hit their 40s, their 50s, and they're just like, man, I just don't have the drive. Mm-hmm. I just don't have, I feel like I'm in a fog all the time. I can't think, I can't sleep. If you're experiencing that, I'd say the best thing to do is go get a comprehensive panel done.
Yeah.
Where they're going to check your testosterone. They should be checking your thyroid. They should be checking liver function, kidney function, do a whole profile on this stuff. Your fasting blood sugar.
And that should be in a fasted state in the morning.
Yeah. So fasted in the morning, that's where your testosterone level should be highest. So you have a good benchmark for it. Mm-hmm. If you're somebody that you find that, okay, I'm 50 and I've got a testosterone level that's 200 and I have all these feelings. Well, you're somebody that may benefit from that. Mm-hmm. Right. So it's worth talking to, somebody that's trained in that and does kind of, that regenerative medicine, HRT practice. I think the only thing I'm a little, skeptical on is anytime you see, this stuff become, kind of in vogue and just push so much, there's potential for profits.
Yeah.
Right. Mm-hmm. And now
you mean drug companies would try to profit off?
No. So it's not even the drug companies though. So it's somebody like me setting up an online clinic, just saying I can create a business off this.
Right.
Right. And, in working with a compounding pharmacy that compounds all these medications and ships to your door, that I can just, I can make a ton of money.
Yeah.
So you get into kind of the ethical, moral dilemma of, being a healthcare provider and doing that. And I'm not saying anybody that's, doing those clinics or behind those is, doing it purely for the money. I think there's a lot of them that are truly trying to help guys. And I hope that's true because I think that, men's health, can oftentimes be overlooked, when it comes to, just your general well-being, certainly mental health. I think as a guy, it's stigmatized, and I stigmatize it myself just personally, not with other people, but it's like, just suck it up.
Right.
Put your head down, keep moving forward.
Right.
Don't think about it, know, and just deal with the depression.
Right.
And and over time it creeps up.
Right.
So,
yeah, it's, fortunately that's been talked a lot about in the last number of years, especially in the military community. It's becoming less stigmatized, but it's definitely still very prevalent.
Still very much there.
Yeah, very much. And, along the lines of men's health, well, finishing up the testosterone thing, like, also don't just take your buddy's advice for it. I mean, you might have a buddy that does mean well and actually is very educated on it and actually did have it work very well for him. Mm-hmm. Or you might have a buddy that's completely full of shit.
Right.
So definitely going through a doctor or potentially multiple doctors, getting some second opinions, and also understanding that that side of it, that your body may stop producing it.
Yep.
Are you ready to commit to this for life?
It's a commitment.
I mean, and then I guess the last thing would be is, I'm not going to say who, but there was a person here that I knew that, went and got his blood tested after taking, I think, way too much of it.
Right.
And essentially had
his hemoglobin's 25.
Yeah. Running through his. Yeah. I mean, and the doctors were like, you are going to have a heart attack or a stroke or whatever any moment.
Yep.
Like, they made him go donate blood that day.
Correct.
And they were like, you got to get this out of here. I mean, they had a hell of a time getting his blood.
Yeah.
So that's the other thing is once you start into that, make sure your doctor's telling you to come back in, get your levels checked, and continue tweaking and checking.
Well, get your levels checked, and then you may fall into a category where with taking testosterone, it drives your hemoglobin level up, right? Mm-hmm. And you may then be on a cycle of continual blood donation, right? So to keep that, hemoglobin level low enough to where you're not going to clot and have a heart attack and stroke, you may have to be regularly donating blood.
Wow.
And a lot of people do that, with TRT. And it's a commitment.
What's the difference between TRT and HRT?
It's just different.
Hormone replacement
therapy, testosterone replacement therapy. So testosterone replacement, we're just focusing right on just the testosterone.
Yeah.
HRT, you're doing kind of hormone optimization, right?
Sure.
So you're looking at not just testosterone, but thyroid optimization and,
Yeah. The other way in thing with men's health is like, when to be getting PSA tests and,
that's another important test if you're going to consider TRT as your PSA and have that monitored.
Yeah.
Yeah.
And then also, checking for colon cancer, right? Having, getting, what
well,
exactly
talking about stigma there, it's like, having a colonoscopy, and this is my wife's field here as far as recommendations, and I think it's down to 45 years old now. Recommend it was 50. I mean, it used to be 60. And I think, you see this the age limit keep creeping lower of when you should have your first screening colonoscopy. And the problem is that a lot of people think that's because, we're just trying to drive more, we're just trying to get paid more.
Yeah.
Where the reality,
evil doctors.
Yeah, I know. The reality of it is that we're finding colon cancers at younger ages now, which is scary.
Yeah.
Because that's really a reflection of how we're living.
Sure.
Right? So we shouldn't be seeing colon cancer in 30 and 40-year-olds at the rates that we do, but we are. And you've really got to question why. Well, what we're putting into our bodies.
Right.
I mean, you can't live 30 years putting a bunch of processed crap into your body and not have anything happen or not develop a cancer, right?
Sure.
So, the chemical exposure is what's put in our food, what's put in our water, all these things. And I'm just a firm believer that it's, the way we live and the environmental exposures that we're seeing just this cancer.
Now, there's a test, right, that you can do instead of a colonoscopy, right?
Cologuard.
Okay.
Yeah. So, if Heather was here now, she would go off.
To avoid having
a colonoscopy,
garden hose up your butt.
Right. And I think that's where the stigma with guys is like, oh, you're going to put a camera up, something's going in my butt. I don't want that.
I'm not gay.
Yeah, I'm not gay, right? I'm not gay. You're not putting anything in my butt. Yeah, you're asleep. You don't even know it happens. It's just like, get over it. If you're a husband, you're a father, would you rather go home and tell your wife and kids like, hey, I just found out that I've got metastatic colon cancer and I've got 6 months, right? Or go to sleep, not even know what's happening, and have a camera put up your butt.
And the reason for that early is to catch the polyps, right?
The polyps. So, you have
because most of us don't want to maybe go get that colonoscopy because you don't want that piece of news.
Well, that's a big thing too, right? I have really good friends whose dad passed away by the time he was 40 of metastatic colon cancer. So the recommendations for them is they should have had a colonoscopy in their 20s, right, to screen for that. So, and that's a fear of, I don't want to know.
But getting a colonoscopy at 45 doesn't necessarily mean you're going to go there and they say, hey, you have cancer.
Correct.
It might just be like, hey, you got some little concerning polyps that we should.
Yeah, I mean, best case scenario, you go and say, hey, it's clean. There's nothing.
Right.
We'll see you back in, 15 years, whatever. Or, they find a polyp and they can remove that before it advances and becomes, cancer.
Yeah.
And that's a win there.
What's that polyp removing surgery look like?
It's like a snare. It's kind of like a snare. There's various, I don't do these, but, I know, they can either go in, if they're really big, they can kind of piecemeal it out with like forceps type thing. Mm-hmm. And these are all little instruments that come out of that long tube where the camera is. So
it's not a real invasive surgery then.
No. And they may do it with a snare if it's the right size, where they just loop over it, pull it back, and it kind of cuts it away from the wall.
Mm-hmm. Yeah. It's all really to prevent having serious colon cancer down the road.
Yeah. I mean, why ignore it when you can, prevent, it's cancer prevention really. Right. It's like women going and having their mammograms. I'm sure that it's very uncomfortable and, exposing yourself and having to do that, embarrassing and all that. But don't you want to know that there's something there that, you're not going to end up, the number of breast cancers that I've diagnosed that were so far advanced, it's kind of like, why didn't you ever go get your mammogram?
Yeah.
It's kind of, with men, it's kind of the same thing. Why didn't you go get a colonoscopy?
Yeah.
Why am I sitting here in an emergency department right now telling that you've got a huge mass in your colon and you've got, tumors all over your liver?
Mm-hmm.
It's like, you're going to enter let's start radiation and we're going to do surgery to debulk the tumor and we're going to start you on chemotherapy. And you go down that pathway and the likelihood is, pretty nil.
Yeah.
Right.
Well, lastly, I guess just opening it up to you, whether it's mistakes you see people making, outdoorsmen, hunters, whatever.
Yeah.
I mean, we've covered a lot of stuff, but, are there any suggestions? I'll just kind of open it up to you. And then also with your prep 'em, if you want to say anything, not prep 'em.
Prep 'em wild, yeah.
Prep 'em wild. Just kind of want to give you the floor a little bit, or
appreciate
if there's anything I've missed, because I'm not super knowledgeable on this.
We covered a lot, and I'd say that, the most important thing is, preparation. And that's the whole part of the prep-em, PREPEM, right? Mm-hmm. Emergency medicine, in the wild. It's preparation and, having a plan. Mm-hmm. And like we touched over, how many camps you go into and you have guides there that are like, where's your stuff at? Or what are you prepared for? And that's really an avenue that I want to go down with this. And, that was an idea that was really brought to me, by a mutual friend, Kip, that, he brought that to me with his adventure in bushwhack.
Yeah, he's a guy that just bought a outfitting service and has a bunch of guides, and you're going to have a bunch of clients that you're responsible for.
Yeah, you now have this responsibility. So, recognizing that it's something that, I've always recognized over the years, but I'm comfortable with it. I'm more comfortable with it because I'm bringing skills with me. Mm-hmm. Where I know not every hunting party has, a board certified ER doc with them.
Right.
And I guess it's something that I myself always overlooked because I'm just comfortable with my own skills. And then when, Kip brought it to my attention of buying, he called me, weeks before he made that purchase, and we were just chatting about it. He kind of brought that up, and my take on it was like, hey man, like I've got the skills. You need help, I'll just fly up there and do some training with them.
Right.
Just get them up to speed,
Right.
No cost, no nothing. Like I'll
but
help you out.
Hundreds and hundreds and hundreds of outfitters and then thousands, tens of thousands of just hunters.
Yeah.
That all need the same thing.
That they all need it. So I think, that's kind of the avenue of this, Prep'em, endeavor and adventure here. And that's, you and I have talked about this, that transition and getting into it and having a full-time job, more than a full-time job,
right?
Making that transition and really getting to a point because, my passion in life is really outdoors and my career, and to marry those two, I think is just like a dream come true.
Yeah.
Right. To really be able to have, skills in emergency medicine and apply it in the outdoor industry would be, it's just now.
Really what would be great is if anyone wants you to go on a hunt with them, they just buy you a hunt.
Yeah.
And, hey, you got a big doll sheep hunt.
Right.
You buy an extra one, you give it to Mike. He'll go with you.
Disclaimer, if you had a heart attack out there, I don't think there's much that's going to be done, but
well,
no, I mean, I'll do my best.
Yeah,
I'll be there. I will do my best. I will work you until the bitter end.
Exactly.
Right.
Yeah.
But
so
now that's a great business model. Just have to find out how to pay the existing bills then. But,
exactly.
No, I mean, in all seriousness, recognizing there's a lot of outfitting businesses out there. There are a lot of guides, and I hope, that a lot of these guys and gals that are, out there and, taking hunters out, that, they're taking the initiative to go to some wilderness courses, to go to some classes and kind of, really up their game in that way. And there's really good wilderness courses out there, and there's ones that are just kind of hodgepodge thrown together. So,
well, the advantage we've got today versus when I started learning how to hunt, at 12, 15 years old in the mid 90s, is we do have the internet. Yep. And there's a lot of bullshit out there for sure.
Yeah.
And you got to be smart enough to try to sort through some of that. But there's a ton of videos and a ton of resources out there to learn and, get the supplies you need and whatnot. But it would be cool if you develop your Prep'em Wild stuff a bit more to kind of consolidate some of that down into one trusted area.
Right.
Especially for the kind of hunting and outdoor community.
Yeah. That's the goal.
Yeah.
Yeah, that's the goal. That's what we're trying to accomplish here.
Awesome, man.
Create, be that trusted resource, within the outdoor industry. So
yeah, how can do you want people to reach out to you, or do you want to put out your socials?
I'm always more. I welcome everybody to reach out. At the stage of this right now, it's just I enjoy helping people. I really do. So I get an inbox full of on my personal Instagram. People reach out asking me questions, and I'm always more than happy to entertain it.
Which is really cool of you.
Yeah, and I just want people to be prepared and be an asset. Not a liability as they're going out. So the more I can help with that, and then as we build up this Prep'em Wild and have that resource there, that'll just be a go-to to kind of review and ask questions through that platform. So
what are your
so my I always have to look at my personal.
Just look up his own.
I have to look up my own personal. It's like Mike _Gerst 35. Is my personal. The Prep'em is Prep'em _wild. PREPEM _wild.
Your cell phone number?
I think enough people have my cell phone number
exactly.
at this point.
I like the Rogan idea.
And everybody recognize I'm in Pennsylvania. So I know a lot of the guys do a lot of traveling West Coast, sometimes overseas, and just respect that I'm on Eastern Standard Time.
Yeah.
So when I'm getting stuff at 4 a.m., but if you have an emergency and you really need me at 4 a.m.,
exactly.
I still answer. I always answer you.
I've personally witnessed it of how you are with our friends, and it's very, very cool. You're an awesome human and
appreciate that.
Obviously very talented at what you do, and thank God there's doctors and first responders and people out there like you taking care of people like us, like myself, that are less than prepared and knowledgeable on this stuff. So
I appreciate it.
It's awesome.
Appreciate the time.
Thanks, man.
Thanks, Josh. Bye.